Welcome to the Job Plus Mental Health Integration Training Program. My name is Vicki No, and I'm a clinical psychologist and the director for the Center for Innovation in Mental Health. We look forward to sharing with you this training program. The first module of the Mental Health Integration Program is focused on giving you an introduction to mental health stress and resilience. In the very first section of this module, we focus on mental health disparities. So this is the first of 6 modules to give you foundational skills for mental health task sharing. This module has 4 sections, which will provide you with an introduction to mental health stress and resilience. The first section will focus on mental health disparities. This will be followed by the science of stress and mental health to give you basic understanding of how stress and mental health are related. Then in section 3 on Mental Health 101, you'll get the basics of how to identify mental health concerns. Finally, we'll end this module with strategies to promote mental health wellness and resilience. The goal of this section is to provide you with an overview of the current mental health crisis we are in. We'll start out with a review of various ways in which COVID-19 has impacted us as a community and the implications that has on mental health, and discuss the mental health disparities that has continued to grow. We'll offer a health equity-oriented framework to guide our understanding of mental health and how this program will support community resilience, particularly in low-income ethnic minority communities. With that, let's begin. We all have seen the unprecedented and widespread disruptions and trauma resulting from COVID-19. Never before has our generation seen an illness that has swept over an entire community and the globe in this way. Although we are now emerging from the COVID-19 pandemic, we probably all remember how scary the first 2 years were, particularly those early months of the COVID-19 pandemic. The rates of infection and hospitalization and even death were extremely high and revealed significant inequities that has disproportionately affected ethnic minority communities. In fact, COVID-19 cases and death rates are 2 to 3 times higher for Black and Latino communities than in white communities. After 3 years, the organizations and support systems are still struggling to meet the needs of the community, particularly in communities that have been historically underserved. Social services and community-based organizations have been overwhelmed. As many of you are well aware, there just aren't enough providers to serve our communities, particularly those from Black and Brown communities. We've heard from providers in our own community assessment about how burned out community providers have been over the past few years. In our next module, we'll talk more about provider burnout and strategies for practicing self-care to take care of yourselves. So stay tuned for that. There's been widespread unemployment, as many businesses, particularly those in the service sector, have had to close down during the pandemic. This has resulted in even greater economic disparities, with the gap between the haves and the have-nots widening. We have seen a rise in unemployment, housing insecurity, and food insecurity throughout the city. In New York City, we've seen these socioeconomic risk rates range from 35 to 50%. And our own study in Harlem, conducted in 2021, we found that in a sample of 393 Harlem residents, 56.5% indicated risk for employment insecurity, 49.6% risk for housing insecurity, and a 44.5% indicated food insecurity. This has caused families to be in greater distress, particularly those that face increased risk and have even less access to resources, such as in ethnic minorities and immigrant and refugee communities. The COVID-19 pandemic has magnified health inequities and has disproportionately devastated Black and Latino communities. Mental health rates have doubled and tripled since COVID-19. Depression and anxiety, for example, have rates ranging from 30 to 56% higher for Black and Latino compared to white Americans. Low-income individuals have 7 times the odds of having depression compared with high-income individuals in 2021. So there's a growing need to address endemic needs related to COVID-19, social determinants, and mental health for high-risk, low-income ethnic minorities. In Harlem, we also found elevated rates of mental health risks, with 41% for depression, 48% anxiety, 73% loneliness, 26% PTSD, and 64% exposed to interpersonal violence. 66% screened positive for either depression, anxiety, or PTSD. These rates are extremely high, 3 to 4 times higher than they were pre-pandemic. These rates were also higher for those residing in affordable and public housing than those in market rate housing. And unfortunately, folks who have been identified with depression, anxiety, or PTSD are often untreated or undertreated. Even before the pandemic, rates of mental health problems have been steadily rising over the decade. Prior to COVID-19, it was estimated that 1 in 5 adults in the world suffer from a mental health condition in a given year. Although we actually know how to effectively treat common problems like depression and anxiety, only about 50% of individuals who need mental health services receive care. So most people who need mental health care don't get it. In fact, mental health services are now overwhelmed with wait lists that are months long. This is why the work that we're doing together is so important. Our approach is guided by a health equity framework. Health equity means that everyone has equal and fair access to resources and opportunities needed to achieve best possible physical, emotional, and social well-being. We believe that achieving health equity requires focus and ongoing societal efforts to address historic and contemporary injustices. There's an urgent need to eradicate economic, social, and other obstacles to health and healthcare, and to eliminate preventable health disparities. In order to achieve health equity, it's essential to adopt a holistic and socio-ecological perspective. Social determinants of health refers to the conditions in which we are born, grow, live, work, and play, and age. These conditions include factors related to economic stability, education, healthcare access, neighborhood, and the built environment, and social and cultural contexts. These social determinants are impacted by structural determinants, which are the systems, policies, institutions, and social norms and practices that determine the distribution of social determinants of health. We must understand and account for social and structural determinants to identify and address mental health-related disparities between communities. The structural determinants include social hierarchies or structures related to race, class, and gender. They're also impacted by policies such as immigration regulations that dictate who gets services. Economic systems that determine banking access and redlining can impact generational wealth, which in turn impacts social determinants of health. Specifically, socioeconomic risks, structural racism, and COVID-19 interact and fuel the current mental health crisis. As mentioned before, communities of color were more likely to lose caregivers and family members, more likely to work on the front line and suffer from burnout. They are also more likely to experience adverse childhood traumas, face greater financial challenges, and have less access to resources in their communities, and more likely to be exposed to crime and violence in their neighborhoods. Therefore, existing inequities have been exacerbated by COVID-19. One useful way to understand all the factors that impact a person's health outcomes is to think about the factors along the stream, with upstream factors being the social and structural determinants we just talked about. Again, they represent factors like education, neighborhood, finances, and social contexts, which shape the conditions in which we live, work, and play. They affect our daily lives. We know that these factors have effects down the road, what we call downstream, and can have significant effects on outcomes like illnesses and ultimately mortality. In order to address the health inequities in mental health, we must take on a prevention and early intervention perspective, where we also tackle the upstream social and structural determinants together while capacitating the upstream systems like schools, community-based organizations, and housing. This strategy helps us both support the systems that address these social determinants while also preventing the bottlenecks that we are seeing further downstream in the mental health care system. By addressing these issues earlier on, we're able to build resilience in communities and fortify community safety nets to help us realize the potential of not only this generation, but also future generations. So now let me introduce you to the Mental Health Integration Program, which we think is a promising community-centered solution to address the mental health crisis we're in. Community providers such as yourselves play such a key role in addressing inequities we see in mental health, because you're already on the front line addressing social and structural determinants we discussed previously. Because community members already go to you for employment and social support, you're already a trusted provider. As a wellness coordinator, a financial counselor, and an educational specialist, you in many ways are already the default counselors. Therefore, you represent a critical touch point and gateway into mental health. You also already have many of the important skills to promote mental health awareness and build community resilience. Because what you already do for NYCHA residents, you're already in the best position to integrate mental health awareness into community outreach, provide basic mental health information and resources, facilitate linkage to care, support routine screening of anxiety and depression, and provide mental health and wellness supports. Mental health task sharing is a strategy that's been used worldwide as a way of addressing the human shortage we are seeing in the mental health service system globally. There's been a lot of research, including our own, that show that it's been very effective at increasing access to mental health resources and improving outcomes. But let's start with a definition so we can have a common understanding of what it means. Mental health task sharing involves the sharing of mental health tasks with non-mental health providers such as community providers and navigators such as yourself, with targeted short-term training on specific mental health skills. Mental health specialists like psychologists, social workers, and psychiatrists are often involved in a team-based model to support task sharers to deliver specific and specified components of care, such as screening, routine monitoring of symptoms, delivery of health promotion or education, and sometimes even brief counseling or therapy-based interventions. To support mental health integration, we recommend a community care model, which is essentially a team-based model where mental health providers are supporting community providers such as wellness coordinators and other employment support personnel to share basic and simplified tasks such as mental health screening, promotion, education, referral, and even counseling. The inclusion of clinicians into the Job Plus model can support a more direct referral source for cases that require more specialized or higher level of care. This allows for a more successful connection to care across the community. One of the many strengths of the Job Plus program is that the mental health supports are getting integrated into employment services, which addresses the social determinants of health. By packaging mental health supports as wellness to increase employability, we not only destigmatize mental health, but also increase engagement and motivation to address mental health concerns. Furthermore, the integration of these services into NYCHA housing also increases our reach into the most vulnerable and underserved communities and has the potential to break the downward spiral of depression and poverty. In order to close the care gaps and address mental health needs in the community, we believe that 6 steps are needed. First, community outreach is needed to promote mental health awareness. Second, it's important to screen and identify individuals who need additional mental health support. Therefore, we'll be using depression and anxiety screener like the PHQ and other brief questions to identify severe mental illness and suicide risk. This is useful to help determine if a mental health provider is needed. It's also really important to get to know your members with a psychosocial assessment to better understand their needs and make appropriate referrals. It's also always really important to educate consumers about mental health and available resources so they can be more active and informed partners in their care process. For those that are interested in getting more support, brief counseling that involves skill building for basic mental health wellness and stress management can be really helpful to build mental health wellness and resilience, and also support their path to becoming more employable. Lastly, we always want to make sure we connect individuals who need additional resources to care and support referral processes so they get all the different types of services that they may need. In Module 4, we'll go into greater detail about the community care model and the steps of this program. You will also be given an implementation guidebook that lays out each of these components, as well as forms and tools you can use to help you engage in mental health task sharing. In summary, the work we plan to do together will help strengthen capacity for mental health task sharing by increasing awareness and knowledge of mental health issues among employment support providers, increase wellness and resiliency skills in communities facing historical inequities, increase access to mental health support, particularly in gateway sites such as housing, and integrates it with employment support, which will increase connections to mental health services. This addresses the interactions between economic risk and mental health, which causes a downward spiral and can break the cycle of depression and poverty. So you will be critical for strengthening support systems that the NYCHA residents have, and in helping community members build healthier relationships, a deeper sense of belonging, and give them much needed access to resources for wellness and job readiness. We thank you for the important work that you do and look forward to working together to build a more resilient community. Yay, we just finished the first section of our first module. Congratulations. Let's recap what we've learned today. Here are some main takeaways from this training. The COVID-19 pandemic has had devastating impacts on communities of color, particularly Black and Latino communities. The rates of mental health problems have doubled and tripled since COVID-19. There's been a disproportionate impact on communities of color because mental health risks are exacerbated by COVID-19, socioeconomic risk, and structural racism. Mental health integration in community is necessary to address the mental health crisis, particularly in communities of color. Mental health task sharing is a strategy for addressing the widening mental health inequities in low-income and ethnic minority communities. Mental health integration in our community care model includes 6 steps: community outreach, screening, psychosocial assessment, client education, stress management and wellness skills, and referrals and connections to care. Here are some key terms we've covered in this training. You can find a complete list of the definitions of terms in this series in your toolkit. Here are some additional terms we've mentioned. We're using the definition of health equity, which you may notice has quotes. That's from the CDC in March of 2022. Well, this wraps up section 1 of module 1. Please take a moment to complete the survey, as we will use this to guide our webinar discussions. We look forward to seeing you at the next section on Community Mental Health Integration Training Program. Thank you very much for your participation.